evening, fellow Americans. Today I would like to be talking about a profound subject that affects everyone in this country. That is that healthcare should be free to everyone in America. Through research and working with Medicare, I've just found that there is no denying that healthcare should be free in America. There are people in this country that suffer daily. They're disease-ridden, they can't afford rent or to put food on the table because they have to worry about their health care. Can I go to the doctor? Do I have to pay these co-pays? What if I get sick? Especially with older people, this is a really big struggle for them. The healthcare prices are extremely high. Medicare is about $175 per month. And that is a lot for some people. Some people that's cutting into their bills, their food, their car, their house. Some people can't afford to pay this. Healthcare is a basic human right and it should be available for everyone. It's a human right because everyone gets sick. And being healthy is a key to a productive life. So we need healthcare so we can work, so we can live happy and healthy, so that we can continue to live without needing to go to the doctor all the time. So like I said, I worked for Medicare and I would take calls for them. So I worked in like a Medicare call center, and among some of the calls that I took, people were crying, people were angry, people were frustrated, people were scared because they were worried that they couldn't pay for food, they couldn't pay for rent or gas or to live in a house and stuff like this. And they would ask me for resources and I would give them resources, but some people found that government assistance was so low that it would actually be better to just not work at all and get government assistance instead of going to work. And this puts us at risk because without going to work, there's no social interaction, there's no one to check up on you, and then that can cause health issues and mental health issues, so physical and mental health, and those bills just continue to stack up. This information can be found on Medicare.gov. It has the premium information, the rules and regulations, everything. And for Medicare, you're even paying, ever since you get your first job, you're paying for your Medicare Part A, but you still have to pay to use it, and you still have to pay every single month for Part B. The lowest standard is $175 a month, and that's a lot of money. I've had people calling multiple times, crying, saying they can't afford rent, or calling saying that they can't afford food and stuff like that, and they're hungry, and I'm like trying to give them these resources, and then they still say like, oh, I make like $100 over that amount, I can't get that, but I literally can't afford to live. Like, what do I do? Like, should I just stop working and get government assistance because that's all that really seems like would help? Another point is healthcare is just like schools. It's like public roads, like police stations. It's just like a public good. So it's not like a luxury, like a new TV or a new car or anything like that, because it is necessary for survival. Children and older people especially cannot truly provide for themselves like they should be able to, and they shouldn't suffer for it. The people with regular jobs may be able to afford it, but it's still an added stress that should just be taken away. With me being 21, I'm already thinking about how am I going to afford a house, all these bills, car, phone, everything like that, and then health care, and then dental insurance, and then eyeglasses insurance, everything like that. So that definitely does cause added stress, and it's like, what if I need to go to the doctor, but I'm in between jobs? Like, do I just have to suffer? I don't know. And another point I would like to point out is that it is successful globally. So there are other countries that it works efficiently. So people have free healthcare in other countries and it works efficiently. It actually works. According to nationalinsurance.com, everyone in Brazil, including short-term visitors, have access to free health care because it is defined as a basic human right. In conclusion, healthcare should be free because it's a basic human right. How are we in a society where some of our fellow Americans are having to choose between food and going to the doctor?